Vitality.
Vitality Unfiltered.
Unfiltered.
With David Bauder.
Welcome back to another episode of Vitality Unfiltered. Today's conversation is about rhinoplasties. And for those of you who do not know what that is nose jobs. With me today is Dr. Alicia Sanderson, a double board certified head and neck and facial plastic surgeon, expert in rhinoplasties. And we are going to work through and talk about the differences or the perception and clear up any myths about rhinoplasties that our listening audience would be interested in wanting to know. So, Dr. Sanderson, if you could start off by describing what is the difference between functional and cosmetic when it comes to nose jobs?
Yep, absolutely. So nose jobs or rhinoplasties are probably one of the most complex surgeries that we do in ENT because the nose is a three-dimensional structure that has to function well. When your nose does not function well, you can't breathe, people are very uncomfortable. So form and function absolutely have to, go together from that. So a lot of times when patients come in and they, want a nose job, a lot of the patients I see from an ear, nose, and throat standard have nasal obstruction, right? So I think it's really important to address what the functional aspects are and then also ask and address what the cosmetic concerns are. Sometimes they'll go hand in hand, and fixing the functional aspect will actually fix the cosmetic aspect. Sometimes they're in direct conflict with each other, and I think that's a very important conversation to have with the patient. So from my personal opinion, every single rhinoplasty should be a functional rhinoplasty that you do cosmetic things on. And I think that's really important when you're selecting your surgeon to have it. There's a lot of fantastic rhinoplasty surgeons out there, making sure that you're selecting somebody who does a lot of nose jobs, because you can have a nose that looks fine, but if it's not functioning, that's a problem. And you need to understand the concepts of how the nose functions.
So you're saying, if somebody was coming like they want a cosmetic nose job,
Correct.
And you do the evaluation, you get ready and be like, look, if we do this, do this procedure, we are going to obstruct your breathing. Yep. Is that essentially what?
Correct.
The piece that we're saying here.
Right. And I actually am pretty, I'm pretty strict in that I want first, do no harm. That's the mantra of being a surgeon in general. And most patients, it's important just to explain that to them when you're explaining it. You can still get them to an improved nasal appearance, but, a lot of patients don't, think about the functional aspect of the nose when they're thinking about, their nose is big, they want a smaller nose, and the aspects of going through there. Talking about the nose in general, the nose is not a focal point of the face. So, when you think about somebody and you think about, they're attractive, you think about their eyes, you'll think about their lips and their smile from there. Everybody knows what Owen Wilson's nose looks like, right? So he, or somebody, Michael Jackson's nose after he had multiple surgeries, they know what that is. But when you start talking and saying like, what is, Charlize Theron's nose or Angelina Jolie's nose look like, people don't really know. They can't necessarily tell you because the nose is not the focal point unless it's deformed or it's larger. So the important aspect of that is when you're looking at the cosmetic aspect of the nose, is that you're looking at correcting things that will stop the nose from detracting from the other features of your face.
I see. Yeah, and then when this procedure is done, like in your practice, like what percentage is functional, what percentage is cosmetic?
Yeah. So again, in my practice, 100% of it is functional because you need to breathe through the nose, and I will address from that aspect. I will do cosmetic procedures, right? And a lot of it would be it, but the cosmetic procedure is not to detract from the function of the nose. So how we breathe and how the nose works is that you have a nasal septum, which is bone and cartilage that runs down the middle of the nose on the inside part of the nose. And then you have the outer part of the nose, which is made up of the upper part is bone, the side walls are cartilage, and then you have a really complex, it's a three-dimensional structure of the lower part of the nose, which is the nasal tip, the alar, and and what we call the columellar, or the tip supporting mechanism from that. And a lot of the problems with cosmetic defects of the nose include the size of the nose, right? The shape of the bones or the the deviation of the bones from one side of the other, if they have, bony ridges on there that distract from it. The tip, which is very complicated, multiple cartilages that, function with each other, and the size of the tip and the shape of the tip. So when you are looking at the nose and analyzing the nose, it's in part of the whole entire face, right? Your nose has very, standard shapes, sizes, and angles of the nose. Like in a shorter woman, they have a little bit more of a rotation of the nose. So depending on what your height is, your rotation probably wants to be between 100 and 105 degrees. If you're a really tall woman, you want to be probably more in the 95 area. Why? Because if you're short, nobody's looking up your nose. If you're tall, people are looking up there, right? So you don't want to have a rotated nose if you're a female that's 5'11", and you want to do it. Men, so then we talk about a feminine versus a masculine nose. Women tend to have a straight or a nasal scoop to their nose, tends to be a little bit more petite. Men tend to have a straight versus a humped nose in there. Their rotation is at 90 degrees. You do not want to have their nasal tip lip rotation over 90 degrees because that's a very feminine nose. So unless you're doing transgender surgery and trying to feminize a nose, there are feminine and masculine features. You have to take a look at your face and the balance of the face. You cannot take my nose and put it on your face because we have different facial features. Sure. So when somebody comes in and they talk about a rhinoplasty and they cosmetic and they don't like their nose, and they come in and they bring me pictures of other people, and I think that that's interesting, but I'm not going to put somebody else's nose on your face. What I want to do is take your features of your nose and take those distracting features and kind of make them less distracting so your nose fits your face. And that's a really important concept when you're going through there. And of course, I'm always going to analyze the functional component to it, because if you take too much of the cartilage away, the nose will collapse and you can't breathe through the nose, right? So you want to make sure that you are not resecting too much cartilage, right? So if somebody comes in and they're like, I want a smaller nose, but I can't breathe through your nose, the answer to helping you breathe through your nose may be a wider nose, right? Because if you open up the space inside the nose, you'll get more airflow. So when patients come in, and a lot of times they come in because they have a functional component in there, we discuss that and we come up with a treatment plan and an expectation that manages both the functional component and the cosmetic component. So if I have to widen your nose to give you a better airway, some patients are like, I am fine with that. I just want to breathe better. Sure. Other patients are like, I don't want a wider nose. I'm like, okay, then we're going to have to compromise a little bit of that function to keep your nose, smaller in there. And there are things we can do to help with that, but that may not be the widest, biggest airway I can give you.
So you've done a lot of rhinoplasties.
Yeah, so probably over 1,000. Yeah, a lot of them. Been doing it for a long time.
That's a lot of procedures.
Yeah.
Revisions. So
yes.
you get a lot of revisions that come in too?
Yeah. So I would say probably for the bulk of my career, probably about 90% of my surgeries were rhinoplasties or nasal surgeries. I would probably say at one point, probably about 60% of those were revisions. Now, revision surgeries are a totally different surgery from a primary rhinoplasty. When nobody's been in there before, the planes are very clear. The treatment options that we do are very predictable, right? There's a lot in the healing process of a nose. The nose heals and you can't necessarily predict how it's going to heal. It's more reliable to predict it if nobody's been in there before. When you go into a revision rhinoplasty, there's a lot of scar tissue. Your results are going to be less predictable and less reliable. A lot of times people have removed cartilage, and they may have removed cartilage from the septum, so we have to start looking for other places to get that from. When you have a primary rhinoplasty, I typically will reconstruct the outer part of the nose or fix the outer part of the nose with cartilage that I take from the septum on the inside, which is deviated. So I'm kind of killing birds with one stone. I'm removing the crooked cartilage from inside the nose and then using that cartilage to rebuild the outside of the nose. When somebody's been in there before, I don't have any usable cartilage. So I have to go and take a cartilage source either from the ear or from a rib. So we go and harvest a piece of a rib and we rebuild the nose. And the goal is to have a functional nose that doesn't look bad, right? Or looks better, or depending on what we're going through. So your outcomes in a revision rhinoplasty are less predictable. And so it's really important when you're selecting a surgeon, if you've had surgery on your nose before, that you definitely have a rhinoplasty surgeon, not somebody that does, rhinoplasties here and there, because the healing process is long and complicated.
Yeah. So talk about the healing process. I've heard rumors that it's like it can be years, right? And so.
Absolutely. So I tell all of my patients when we do a rhinoplasty, it's at least a year of healing. And that doesn't mean you look bad for the whole year, but it means if I took pictures of you at 2 weeks after surgery, at 3 months, 6 months, and a year, your nose is going to look different. And I watched that for 20 years as I've gone through and look at it. We go to our academy meetings and we're doing, lectures, and people and famous rhinoplasty surgeons will show pictures from a year after they've done a rhinoplasty and 5 years later, and the nose is still changing. And that's because it's this very fragile, delicate, three-dimensional structure that is influenced by scarring. So scarring, healing. So I can go in and I will put it where it's supposed to be. It will be straight on, but the bones will shift and move and there'll be scarring. So it's really important when you go in to do that you can predict what's going to happen.
Sure.
And so when I'm in there, I can go in there and I can move it, but I go, well, if I take cartilage from the upper part of the nose here to make a more petite, cute nose, I know that when the scarring happens, it's going to rotate the nose upward because the tip is like a tripod. And so as you take out part of it, as it heals, it's going to rotate up. So I predict that when I'm adjusting the rotation of my nose. So when I go in, I may not rotate it up as much as I think it needs to, knowing that when the scarring process comes in, it's going to naturally pull it up a little bit. But the significant aspect of the swelling is probably in the first few weeks afterwards. So as far as, time you need off of work, if we're doing a lot of work and breaking the bones, then I'd probably say a week to 2 weeks off of work. So you don't, you don't look bad in there. But when you come back and see me at a month, I'm going to tell you you're still really swollen. And then when you come back at 3 months, you're going to say everything is looking good except for this tip. The tip is really swollen. The tip takes a good year for that swelling process to be in there. So it's important that patients understand that, because this is all about expectations. I want you to feel the best you can about it. But if you're expecting to look normal, a week after surgery, that's not going to happen, and you're going to be disappointed for the whole time afterwards. So setting reasonable expectations and goals is really important with your rhinoplasty surgeon.
Yeah, just like making sure, and like after hearing this, I'm just sitting here like making sure that the patients understand that their nose is going to keep changing years after the procedure.
And the more you do, the more it's going to change. So again, these are the important things that I talk to about patients. Like some patients just want to breathe better. And we talk about, hey, we can do this, and we can do like a basic down and dirty. I am going to go in there and give you wide open in there, not do a lot of work. If I do a lot of work, I do a lot of breaking the bones, shifting the bones, adjusting that cosmetic things, the healing process and that predictability, there's more variables in it. And those are important conversations to have, because some people are like, I really don't want to have, I don't really want any changes. I like my nose. It's who I am. It's what I look like. And then I have other people who are like, no, I really want to fix these things because it affects how I feel about myself, and it's always really bothered me. And so getting those.
What's your thoughts on using fillers on the nose?
Yeah. So I am not a fan of using fillers on the nose. So there's a lot of risk to vascular occlusion and damage and loss of skin when you're using fillers in the nose. I am not a fan of liquid rhinoplasties, right? It's, they're temporary. They'll eventually go away. But if you need a rhinoplasty, you should go have a rhinoplasty, because when you go in to get the rhinoplasty, you've now got scarring, filler, and problems in there. So as a rhinoplasty surgeon, I am totally against it. I'm not totally against it, but I am not a big fan of it, because I feel like you need to do the definitive procedure. And again, going in the first time to do it when nobody has been in there, just wait, have the procedure done, and then you'll have the results that you want on there, as opposed to keep going back and injecting fillers. Now, I have used fillers very conservative in patients who have had multiple surgeries on the nose. This is a really high risk area, but if they have a certain defect that really bothers them a lot and it's too risky to go in and do another surgery, then I've used it very conservative, but that is very uncommon. I am capable of taking care of any complications that could potentially come from it, but I definitely don't think that that the novice injector should be putting fillers in the nose.
I have not put fillers in the nose.
Thank you very much. I appreciate that.
Does a cosmetic functional rhinoplasty, you had to obviously repair fractured nose?
Correct.
People that have had injuries,
absolutely,
right?
Yep.
Is there a big difference on how they're managed?
No, there's really not there's not a big difference on how they're managed. And a lot of times, you're going in and doing, the same things and breaking the nose and, and going back in there. I think a lot of times when people have had prior surgeries or they've had trauma in there, a lot of people say, I want my old nose back. And I think that that's really hard to guarantee that you're going to give them the exact nose that they had back. I think a better approach is that, like, I had my nose fractured, and now I don't like that it's deviated here. I don't like this hump, or I don't like this things. So, when you're talking to your rhinoplasty surgeon, having specific things that you don't like. I don't like the width of my tip. I don't like this here. Saying something like, I want my old nose back, it's harder because then the expectations of disappointment, as opposed to saying something like, I don't like that it's crooked. I want it straighter. And those are, and that's something, okay, well, that's a tangible thing that we can work on to go through and get.
Dr. Sanderson, great information. This has been fascinating.
Thanks.
I want to go ahead and thank all of our listeners for following us today or listening to our show. If you liked the episode and like the show, please follow us or click the subscribe button below. Thank you for joining us today, and we'll see you next time.
Thanks for joining us on Vitality Unfiltered with David Bauder. Addressing norms, busting myths, and uncovering health realities for a more vibrant life today. For more expert insights and real talk, make sure to subscribe and join us next time.